with you. Good afternoon, everyone. My name is Britt Anaskevich, and I am the Strategic Public Financing Coordinator at Children's Opportunity Alliance. You'll see here I'm joined by my wonderful colleagues, Kimberly Rosnick, our Executive Director, Laura Jerome, Manager of Strategic Initiatives, and Desmira Quinones, our Office Manager. And this amazing team is making this conversation possible for us today. So a big thank you for your help. And it's wonderful to see such a passionate group here today. So thank you all for being here and for your commitment to early care and education. And welcome to our webinar, Fiscal Investments in Montgomery County's Early Care and Education System. So I see some familiar faces, so welcome. First we're going to get started by sharing the agenda and the format for our conversation. I'm excited to share insights from our FY22 and FY23 fiscal map research. And today we're going to discuss what a fiscal map is and its importance. We're going to share key takeaways from our findings and analysis. We're going to share data on our county's children and how they're doing. We'll engage with the data in a robust discussion. And we'll show you where you can access this report and how you can use our searchable database of funding streams that we identified. And then lastly, we'll share some next steps, including how we've used the data so far. And we want to hear from you, your ideas on how we can use these findings and get involved with us on our system change efforts. So the format is that we really want this to be an engaging conversation. So we'll share some findings, and then we will stop along the way at certain points, pausing for you to take in the data or to ask questions. These sections for discussion will be timed. So we'll continue to move through the presentation to be sure that we can share everything that we intended to share with you today. So I'll let you know that throughout the presentation, when we're opening it up for questions, and then at that point, you can raise your hand, we'll call on you, you can unmute, we'll take your question. Alternatively, you can put your question in the chat throughout the conversation, and we'll work to get it answered either today or through a follow-up email. And then at the end of the presentation, we'll also open it up for questions again if we have time available. So there should be plenty of opportunities for us to discuss the data today. Great. So first, what we want to do is take a moment to share about Children's Opportunity Alliance. In 2022, the Montgomery County Council designated the Alliance to serve as the county's early care and education coordinating entity through new legislation. Our vision is that every young child in Montgomery County has an equitable start in life, creating a stronger future for us all. Our mission is to connect our community to build an equitable, accessible, high quality, and sustainable early childhood system that narrows disparities and puts all children on a path to reach their greatest potential. We also want to acknowledge the efforts of Montgomery Moving Forward, whose advocacy and collective impact efforts highlighted the need for better coordination and funding for our early care and education system. In 2018, Montgomery Moving Forward sponsored the first fiscal map, which was completed by Children's Funding Project. And one of the recommendations from that report reiterated the importance of establishing a coordinating entity, and that's us. In the creation of Children's Opportunity Alliance. So we're so happy to be here for that. The Alliance maintains a 360-degree view of the system, keeping an eye on and partnering to influence strategy, priorities, programs, policies, and of course, funding for children from birth to 5, and the adults who care for them, creating collaboration towards solutions to system inequities. And as a result, the Alliance hired me as the Strategic Public Financing Coordinator and engaged in a coaching and training contract with Children's Funding Project to support us in building our county's capacity to develop our community's fiscal map, which allows us to continue to track and analyze investments in Montgomery County's early care and education system. So I want to thank everyone here today from Children's Funding Project and the Children's Funding coordinators that they've been supporting. Here in Maryland, we're happy now to have a children's funding coordinator stationed at the Governor's Office for Children. And we'll be partnering closely to align our efforts in Montgomery County with her role in tracking investments across the state. So before we jump in, we want to first take a poll to see what we know about fiscal maps. So in a few seconds, you'll see a prompt come up on your screen to answer a question. And just please select what you think is the best answer. Here's the question. What is a fiscal map and why is it important? So I will launch that now. And do. That's my Jeopardy music. It seems like overwhelmingly people are selecting answer number 3. It's all coming in. Look, it's unanimous. I'm going to end the poll and share the results. All right. Great job. I know that was really easy. You're right. The answer is number 3, and we're happy to see that most of you got that right. So what is a fiscal map? A fiscal map helps us to answer the question, who is spending how much money and for what purpose? Think of a fiscal map as a tool that helps us understand how much money is flowing into early care and education for children ages 5 and younger and their families and what it pays for. This is funding for a wide variety of programs, for scholarships to educators to earn teaching credentials and degrees, for family subsidies to help pay child tuition, for children and families in need of mental health, child welfare, or school-based health services. These are just a few examples. The goal is to see how much money we're spending in Montgomery County and where it's going, so we can decide if we're spending it equitably for the children and families who need it the most. It also allows us to plan strategically and make important decisions about where money should go and how much we need for our goals of creating an equitable, accessible, high quality early care and education system. So great. So now that we know what a fiscal map is, before we get into our analysis, we're going to ask you to keep a few things in mind along with 4 key takeaways. First, we want to share that this is just a starting point for the Alliance and its partners. Our intention is to annually conduct this research, analyzing trends in funding over time, and continue making this data as comprehensive and accurate as possible. So we're still learning. And although we may not have all the answers, we're excited to share this journey with you and explore how to use this data together. Secondly, you will see some very large numbers, some in the millions and billions of dollars. And your immediate reaction might be, wow, this is a lot. So to make this easier to digest, we have 4 key takeaways from this research that if you forget anything else, these are the things that we want you to remember. First, Montgomery County's early care and education system is complex with multiple decision makers. The most money in the system comes from parents who are shouldering the burden. Government and philanthropy have stepped in to relieve some of that burden, but there is still a large unmet need, causing system inequities. And there is still a need for greater investment through coordinated strategies that address these system inequities. So I'll pause here for you to read these again and hold these in your mind. Great, now we're going to show you how we arrived at these key takeaways. So first, Laura will share some data about our children, how well they're doing, and the large unmet need.
Thanks, Britt. So the Children's Opportunity Alliance has been working hard over the last year to analyze data that helps us understand the needs of the youngest children in our county. Montgomery County is the largest county in Maryland with over 1 million residents, and it's becoming increasingly more diverse in terms of race, ethnicity, and primary language spoken, which can make effectively serving children at scale a challenge. Children under 5 represent 7% of the total population, with just under 75,000 children living and learning in our county. Yet, many of these children in Montgomery County have needs that are not being met. More than half of our children are not entering kindergarten ready to learn. Again, more than half of children are living in families with incomes below the self-sufficiency standard. Over a third of children are food insecure, a third are facing housing insecurity, and a third of women do not have access to early prenatal care. To advance equitable outcomes, it's essential that children are supported in holistic ways from birth. We have a lot more work to do to improve these conditions for young children and their families. And I'll hand it back to Britt to get us into what we found in the financial data.
Thank you, Laura. So with that context in mind, let's move into the fiscal data. We want to show you how we collected the data, from whom we collected it, and what's in and what's not in the report. As we mentioned, we decided to research investments in fiscal years 22 and 23, and for county government, this time frame runs from July to June. So here's our data sources. They included an analysis of school district and government budgets, a review of county subcommittee session reports, and interviews with key stakeholder groups. This was a year-long process attesting to the complexity of the number and types of decision makers and budget holders we made contact with in order to gather this data. And this involved reviewing city and county operating budgets, sending our findings to partners and budget holders in the county executive's office and the Office of Management and Budget, as well as the school system and city government leaders. We also obtained state fiscal data from the Department of Education through a Public Information Act request, and had conversations with nonprofits and philanthropic leaders and childcare providers. Again, a very complex system and process, reminding us how essential collaboration is to understand who we are serving and how much it costs. We wanted this first data collection effort to be as accurate and comprehensive as possible, yet there were still large pieces of data that we could not get verified. Here are some of the limitations of the data. I want to be clear that we were not able to find every dollar invested in young children. There were still some very large financial investments we were not able to show, including expenditures for Medicaid and children's health insurance, the Child and Adult Care Food Program and WIC, workforce training programs, in addition to others. We also didn't include non-monetary contributions, but we know they play a vital role in supporting our services. One complicating factor when reviewing these data is that some of the figures are included as appropriations. And what this means is that they were designated to support a program or resource during the budgeting process, while others are included as expenditures, meaning what money actually went out the door during that budget year. So for example, an appropriation is what MCPS budgeted to spend on early intervention and special education programs. An example of an expenditure is how much money was paid out to providers in Montgomery County from the state of Maryland for this child care scholarship program. Finally, the parent tuition figure that you'll see is included as an estimation. We'll show you later how you can access the full report where you can read more about these limitations. Great. So jumping in, here's what we found. Caring for and educating young children is an expensive undertaking, with over $640 million spent annually. Yet we know there continues to be large unmet need for young children and the adults who care for them, as you saw earlier. The majority of money in the ECE system comes from parents paying to access services. Parent tuition and fees for regulated childcare alone are estimated at $419 million, or 65% of all identified investments in the system. Public funding supports the system at 35% of all funding, or $221 million, including federal, state, county, and city sources. And philanthropy, it's roughly 1% of our early care and education system. I'm going to stop here and open it up for questions as you review this data. You can raise your virtual hand or you can put your question in the chat, and we're going to set a small timer for this one. Don't be shy. Jump right in. We're happy to struggle through the data with you together. Or drop it in the chat. Hi, Craig Small. We see you. Thanks for joining us.
Okay, Britt, at this time we have we have one question in the chat. Here we are. And this is
Alrighty.
a logistical question. Will we be able to access the slides after this meeting?
Absolutely. Thank you so much, Karen. Yep.
And here's another one. Let's see. Why did you have to use freedom of information requests with MSDE? Were they reluctant to share?
You know, that's just their process, you know, and we had such a large data request. I mean, we had a large data request. So in order for them to get that done, it usually takes 30 to 60 days for them to respond to us. Laura or Kimberly, do you want to share anything else on that?
Yeah, as a large state agency, I think you can imagine that so many there's a lot of people that are interested in MSDE's data. So it would just be an administrative burden to have data sharing agreements with lots of agencies. Their direct line of communication is through the local education agencies, meaning MCPS. So really the only way for organizations like us that are not an LEA is to go through the MPAA process and request it. But they shared it, right? So they weren't reluctant. It's just the process that we used.
Thank you, Laura. I see one here about philanthropy. And why did philanthropy go down? Kimberly, what do you think? Do you want to?
I can answer this, and I was just typing in the chat. But so in fiscal year 22, the Godelsky Family Foundation gave a large gift to Centronia to start their new center in Silver Spring. It was over $2 million. So that is why there is the drastic drop from fiscal year 22 to 23.
Good job. All right, thank you. And then we have a question. Was the drop in public funding from 22 to 23 a result of expiring federal dollars or other factors? Bingo, that's part of it. Absolutely. You'll see in our pandemic era relief fundings data that we had a significant infusion of funding in FY22, and then it did taper off in FY23. Thanks, Kenny. Let's see, was there anything that surprised me? I think we're all going to have our varying degrees of analysis of this. I think what surprised me was the funding for 0 to 3-year-olds. And we'll see that later on in the presentation, that we need to look at spending more money for our very youngest children. And it also surprised me of the huge infusion in the pandemic funding, and then how it was tapering off in 23. That surprised me quite a bit, as well as the parent tuition. I mean, that absolutely shocked me. I have to say that was the first thing that shocked me the most. Thanks, Joanne. So how did you decide what to include and not to include in the fiscal map, including WIC? It really came down to access to the data. And so there are providers across the county who are, seeking reimbursement and managing this funding source. But we largely went to the state to get that funding, and we were able to receive some of the funding expenditures, and some of it we weren't. And we also worked with our Department of Health and Human Services to get some of that data, and some of it we were able to get and some of it we weren't as well. And so we're just going to keep building on this year after year, and hopefully we'll be able to get that for this fiscal map that we're developing now. Thanks, Haley. Pilar, what are the goals for the different sources of funding for the coming years? That's a great question. Wow, Pilar. I think you'll probably be joining us on some of these conversations we're having on strategies and priorities and goals. Kimberly or Lara, do you want to add to any of this?
I think that's for the community to decide, right? And we're excited to be leading a common agenda planning process this fall, where we are engaging the community and helping us set strategies and goals for improving the system. So I can't say that that's been decided yet, but we're hoping to have a little bit more clarity on that in the coming months. So thanks, Pilar.
Yeah, thanks, Pilar. Thanks, Lara. Okay, so we're going to jump back into the, and James, we'll get to your question. We'll get to your question as we can. Thank you. So, all right, so we're going to go to the next slide and talk about the business model. So we want to share the context in which providers are working. So the over-reliance on parent tuition leaves the childcare industry with an unsustainable business model. Because so much of the system's money comes in through parent tuition, providers can only charge what parents can pay. Otherwise, providers must accept the reimbursement rates set by the state and county for eligible families who receive scholarships or subsidies, and that rate does not represent the true cost of care. This unsustainable model makes it hard to provide high-quality care, attract, compensate, and retain qualified workers, and keep childcare businesses open. Now we're going to show you a breakdown of funding by public sources. The ECE system is made up of numerous decision makers allocating funds through various agencies and service providers, leading to significant system complexity. As you can see here, among the public funding sources, our school system, MCPS, allocates the largest investment of funding to support pre-K, Head Start, special education, and early intervention. Here, we've labeled city, county, state, federal, and federal relief funding. You can also see MCPS blended and DHHS blended funding. And just to explain a little, DHHS blended funding is grant-funded dollars that our county's Department of Health and Human Services receives that do not come from the county, but we just don't know yet if they're state or federal sources of funding. And we'll be working with our partners to detangle this more. For MCPS blended, we understand that MCPS receives funding from multiple sources and then allocates budgets to departments and programs such as pre-kindergarten. We're going to share more about the detail for both DHHS and MCPS later in the discussion, but I'm going to pause here and again open this up for questions. And again, just drop your question in the chat or raise your hand and come off mute. So James's question, how many children are involved in the FY23 $640 million figure? That is a tough question to answer.
Yeah, I'll jump in here, Brett. So Jim, I'm sure you can imagine that estimating how much money that goes out the door in tuition payments is an imperfect process. But what we did was take the number of licensed seats in the county, and then we subtracted out the number of children that we know are using Child Care Scholarship and Working Parents Assistance Program, and then multiplied that by the average weekly tuition according to Maryland Family Network. So we'll have a little bit more clarity, but it's around 30,000 seats in our community, and minus those that were using subsidy.
Thanks, Laura. That was really helpful. I was going right to the calculation. I was going to seats, and I was like, "That is it's a good question, Jim." Larry's asking, how much of MCPS funds go to private providers and how much stays within MCPS? Okay, so that is also another challenging question to answer. We have that showing up actually further down in the slides. So we're going to get to actually how much community-based pre-kindergarten Well, the pre-K expansion grants are going to community-based providers, and how many seats that accounts for. And then we're also going to show MCPS seats for pre-K and Head Start. So it'll be a little bit further down in the presentation. Do you want to jump
But
in and
just
say
to-
anything about that?
Just to clarify, MCPS funds are used by MCPS. They certainly have contracts in the community. But the private providers that participate in pre-K get money directly from MSDE, so from the state, and not from MCPS. So that is none for this fiscal map.
Gotcha. Yeah. And then Jody's asking, can you clarify, did you say that Head Start funding was counted under MCPS funding? It is, yes. They provide Head Start services within their school system, and you'll see that broken down a little bit further on in the presentation.
Brent, can we say just one clarifying piece about that though? The Head Start dollars that come into Montgomery County, they actually go to the Community Action Agency first and then go to MCPS. But for the purposes of simplifying where dollars came from, in here we had them flowing, the dollars counted under the MCPS dollars because they are expended by MCPS.
Thank you. This was,
And I
as
would
you can see,
add that the early Head Start funding is here in the federal bucket, as that goes straight to 3 private providers.
you can see this was an entire organization of learning. This whole where do the funds originate? Where do they go? How much? Who designates it out into the community? Okay, great. So should we jump back into the presentation? All righty. Okay, thank you guys for your great questions. Thanks, team, for helping to answer those. Okay, so we're going to go to pandemic era relief funding. So here's what we received. We're in a unique situation where substantial pandemic era relief funding boosted the sector in FY22. And this was 10% of overall investments, and it decreased in FY23 and now has ended. In these fiscal years, we know that $53 million went directly to childcare providers impacted by closures through childcare stabilization grants, and that other funds enabled the state to create the Rebuilds grant program to pilot innovative new ideas, like Montgomery College's new early childhood education alternative certification program and Echelon Academy's new mentoring program. So we're going to pause here for a moment just so you can just soak in this data. There's a lot to look at here. Okay, great. So the influx of federal relief funding contributed to improvements for an increased participation in the Child Care Scholarship Program. And you can see here that in fiscal year 22, Montgomery County received $17.7 million to support child care scholarships, and then it doubled in fiscal year 2023. Increased participation in this program necessitated an increase in funding for the county's Working Parents Assistance Program, which provides a supplement to providing to providers who account for the high cost of living in the county. And again, we're going to pause here so you can take this in. Next, we're going to look at participation in the Child Care Scholarship Program. Despite this increase in participation, less than 10% of the total income eligible population participates in the Child Care Scholarship Program, less than 10%. There are approximately 27,000 children ages 5 and under in Montgomery County who meet the income eligibility requirements for CCS, and approximately 10,000 who meet the income requirements for WPA, Working Parents Assistance Program. So again, I'm going to pause here for you to take this in. Okay, now we're going to move on to talk about the blueprint for Maryland's future. Laura's going to talk us through that and how this has impacted Montgomery County's efforts and investments in pre-K.
Sure. So in 2021, Maryland passed landmark legislation, the Blueprint for Maryland's Future, that is causing sweeping changes to both the expectations for the delivery of pre-K services and the funding coming into the county from the state. MCPS and qualified licensed childcare providers can apply for funding through pre-K expansion grants from the State Department of Education, or MSDE, to operate pre-K classrooms. In this chart, you see that 7 community-based providers received the pre-K expansion grant, representing 207 seats in FY23, which was a decrease from 9 providers and 238 seats in FY22. For comparison, MCPS also received funding from MSDE through the same pre-K expansion grant, and they received $240,000 in FY22 and $780,000 in FY23. So nearly a third of our public funds for early care and education in this county are allocated through Montgomery County Public Schools. MCPS substantially increased their funding for pre-K seats by blending federal, state, and county dollars, such as the per pupil formula funding from the state, the federal Head Start grant, Title I funds, and county general funds. They increased from $24 million in FY22 to $34 million in FY23. This allowed them to flip many part-day seats to full-day seats and grow from a total of 3,113 general education, pre-K, and Head Start seats to a total of 3,248 in FY23. But special education services represent the largest funding in the system, and demand does continue to grow. MCPS budgeted $56 million in FY22 and $60 million in FY23 to provide early intervention services. This is including infants and toddlers, child find, and the preschool age PEP programs. So we're going to stop here again to pause and answer a few questions. So again, you can raise your hand or add your questions in the chat. And I do want to make sure I clarify again for Jody's question. I answered this in the chat, but when we knew the source of funding, right? So the Head Start federal grant here, we knew is federal. The Title I federal funding, we did put that in the federal bucket that you saw on the total pot slide. But for these other ones, so for example, the Head Start, the local funding match, they could have used county general funds, the formula funding. It could come from a number of sources, and that's why it's in the MCPS blended funding. So you'll, if you're have an eye for detail, you'll note that the total here is a little bit different than the MCPS blended funding on that previous slide. And it's because when we knew the source, we put it there. I see one other question in the chat, Jim. How much of the 64 million goes to care and how much goes to education? I love your questions. This is a really interesting one, but I'm going to go ahead and say that when it comes to our youngest children, you can't separate care and education. They're one and the same.
Wow, that was a beautiful answer. And kind of attesting to how hard this was. The complexity. We do show pre-K and Head Start. And, you know, if we labeled that just as education, we could separate those out. But we are looking at the entire system as a whole.
Okay.
Okay, keep going.
Yeah.
Jump right back in. Okay. All right. So we're going to talk about DHHS, our Department of Health and Human Services. So thanks, Laura. Our county Department of Health and Human Services distributes nearly $37 million, and it's a blend of federal, state, and county funds, supporting a diverse portfolio, as you can see here. With the help of the Office of Management and Budget, they provided expenditures for services for the prenatal to 5 population, including child welfare, community health centers, early childhood services, public health, grants and contracts, and child care subsidies. We'll pause here for you to take in this data. Okay, great. Thanks, Laura. We're going to now look at investments that the county makes in the early care and education system. And you can see we've added here the community grants, Department of Health and Human Services, libraries. The county's made much effort to look at the early childhood system holistically. And overall investments, among these investments, we were able to include the the ones I mentioned, as well as the county executive's Early Care and Education Initiative and Children's Opportunity Alliance. But total, it represents just 2% of its operating budget. And we estimate that investments would have to increase by more than 3 times to match the population of children under age 5. In the full report available online, and we'll show you how to get that, you can see expenditures for both our organization and the county executive's Early Care and Education Initiative. So we're going to pause here again so you can take this in. All right, moving on to philanthropy. Let's take a look at how philanthropy has supported the system. It represents 1% of all funding that we've identified, leaving nonprofits to rely on county grants and contracts or the donations of wealthy individuals. Applying for grants and building these relationships requires nonprofits to have substantial internal capacity that many just don't have. Smaller grassroots nonprofits struggle to get started in Montgomery County, and there are relatively few nonprofits that focus on early care and education. So again, we're going to pause here so you can take a look at who we've identified is funding through philanthropy. Okay, so the last section of this report provides further analysis of the funding, showing the many ways in which the money is used in the county and who benefits from the services. For example, analysis shows that more money is spent on preschool age children than on younger children, from prenatal care to 3 years of age. Given that 90% of brain growth happens before the age of 3, it's crucial that more investments support our youngest children. And again, I'll pause here so you can take this in. We also analyzed the data by ECE services. Analyzing public spending by service, more than half goes to childcare seats in general, pre-K nutrition support, and special education. And again, as you can see, there was a large infusion of COVID funding, attempting to stabilize the sector in FY22, and then it tapered off in FY23. So great. So while we're nearing the end of our presentation, we want to remind you of the key takeaways. Our early care and education system is complex with multiple decision makers. Parents are largely shouldering the burden. Government and philanthropy have stepped in to relieve some of the burden, but there's still large unmet need causing system inequities. And we need greater investment and coordinated strategies that address these inequities. Okay, great. What's next? What are the next steps? Our next steps in the process are to share the findings with both the community at large, such as through conversations like these, and we've shared parts of the data already through 3 other community convenings, where we've gathered input and feedback from parents and other community stakeholders. We shared this report with county council members. We'll continue to research best practices and program costs and conduct this research annually to track trends in system investments. And we'll use this data alongside child, workforce, and program data and engage stakeholders in strategic conversations. Together, we can set priorities that make up a common agenda for early childhood systems change in the county. So now we're going to show you where you can locate the report. Laura's going to load the website. So you can find the report on our website at mocochildren.org/fiscal map. And we're going to add that to the chat so you can click on it. Again, it's mocochildren.org/fiscal map. And here you're able to scroll through a shortened version of the report, and you can also download it. You can go to the bottom of this introductory letter and click on this form to share your thoughts. And we'd love to hear your comments and feedback. There's also a shortcut to each of these parts of the report: an overview tab, a data tab, a searchable database tab, and a share your thoughts tab. So you can see this is all pretty self-explanatory, and we hope it's pretty easy to navigate, but please do give us feedback on it. So we're going to jump into the searchable database. So you're going to want to click on this tab, the searchable database tab. And that's for people like me who are really curious about all the funding that we identified. The searchable database starts with a little bit of background on our fiscal map research and a menu of options, including tabs labeled FY22 and FY23 summary, showing both fiscal years, FY22 and FY23 tabs, each showing each of those fiscal years, an eligible population tab, eligible services tab, a funding recipient tab, a funding by age tab, and at the end, the methodology. So you can either go to this first page and click on each one of these tabs, and it'll take you directly to the screen where that data is, and you can advance, or you can advance through the screens at the top or bottom. There should be arrows. So great. You're probably wondering, so how will I use this searchable database? So you might ask a question of the data, like, where do I find all blended funding that MCPS receives for early care and education for both fiscal years? So first, you want to click on the tab that says FY22 and 23 summary. Then you want to unclick select all, which is that box on the side. Then you want to click blended funding for MCPS. And you can see it show up here in the bar graphs for early learning. And you can scroll through the bottom, thanks Laura, at the bottom of the screen, this table for the detail of all the funding streams and amounts. So let's show another example of how you might use this. So let's say you want to see funding for childcare providers. First, click on the funding by recipient tab. Then click on the bars in the chart labeled childcare providers. And then scroll through the table at the bottom of the screen for the detail. So folks not data savvy, and maybe you're worried that if you click on something, you'll break the database. Don't worry, it's not possible to do that. So feel free to engage with it for your needs, and just click around and play around with it. And do please let us know if you see anything that we need to, that you have questions about. So also just like Laura showed, you can select and deselect the box that she was clicking and unclicking, and that is a way that you can sort of filter by city, county, state, federal, private. So now we're going to switch back to the presentation for our last slide and just talk about ways that you can contact us and stay involved. Here we go. So we want to thank you so much for joining us as we talk through the FY22 and FY23 fiscal map research and findings. As you reviewed the data, you asked some really good questions. You gave us a lot to think about. And if you click on the QR code, that'll take you to a survey to give us some feedback on the presentation. And we'll also drop that into the chat. Here's also my email and a reminder of where you can access the report and use our database. And we want to invite all of you to join the Alliance as a partner. So please do consider signing up for our e-newsletter. So we'll drop all of those there for you. And as we're doing that, we're going to open it up to hear any last questions. We have about 10 minutes for these, and we welcome questions, feedback. We also welcome strategic recommendations on using the fiscal map. So feel free to come off mute, raise your hand, drop your question in the chat, whatever works best for you.
I do see a question in the chat from William. He's saying, am I wrong in my understanding that the MCPS budget is not controlled by elected representatives, but only approved or disapproved? I would say the budgeting process in the county is certainly complex. MCPS goes through their own budgeting process and does submit it to county elected officials for approval. So the county council cannot adjust individual line items in the budget, but they can reduce the total amount that MCPS receives. So we did see that in this last, or in the current fiscal year, they reduced the amount by $30 million. And then MCPS had to redo their line items to be able to, add up to that total amount that they were given. So it's a little bit more nuanced than just a blanket approve or disapprove. But yes, they don't control the expenses or line items.
But the Board of Education, which are all elected representatives, do have oversight of the budget for the school system.
And then William's asking also, if parents are shouldering the burden of childcare, how does that impact individuals' decision to start a family while living in Montgomery County or leave the county in order to start that family? That's a really good question. I think what we're starting to do is engage in conversations with the office of the state comptroller's office. We've been hearing a lot about how not necessarily only in Montgomery County, but across the state, women are dropping out of the workforce. 100,000 women dropped out of the workforce to care for aging parents or children. And so we're seeing that it is affecting our workforce and people's ability to really live in their best means. We know that it costs parents more than a quarter of their household budget to actually afford childcare. So, the federal government says that 7% is the recommended amount that a family should be spending on childcare. And of course, 27% is way higher than that. And so it's a choice. Sometimes it's a terrible choice between working and your basic necessities of food and housing and transportation. So it's pretty unsettling, to say the least. Right, Larry's got a statement here and a question. Let's see. I know I say this every possible time, sounding like a broken record, but we need to also look at what the district, DC, is doing as it incredibly affects Montgomery County. Of course, we are absolutely looking at that. Their pay equity fund and new access to childcare for children with disabilities, absolutely, Larry. And so we're working on those cost comparisons right now so that we can not only learn from them, that then also bring some clarity for this for our county. Anything you want to say about that, Laura or Kimberly?
What I will also say is I think there is a broader and understanding that childcare is a regional issue. And so what happens in surrounding jurisdictions to a community often can impact what is happening within that community. And so we see that with DC. And we don't necessarily have fiscal comparisons, but what you see is that DC by far has broader access to childcare, pre-K, and other supports for families with young children. But I think the challenge we struggle with here in Montgomery County is scale. We are much larger than DC. DC is its own state. So because of that, they are able to do some of their own things that make it a little bit more difficult for us as a county to do. So yes, definitely aware of that and keeping it in mind.
And thanks, Kimberly. And James Jim, you have a question about KRA. The latest KRA report says that 46% of our children were ready for kindergarten. Has anyone done the research to determine how that actually happens and how it might be expanded? Jim's got a question. Jim, you're stumping us, Jim. Good questions.
It's a complicated question, Jim. I think that there are multiple factors that impact a child's readiness. One of the one of the best ways to ensure that children are ready for kindergarten is to enroll them in, to give them access to quality formal early care and education through high quality education providers such as childcare. But it also involves having access to healthcare, holistic supports, mental health, family sustainability through, things like that. So when we look at the children who are not ready, often they're from low-income families. They're still learning English. They have disabilities. And so we know that we need to target strategies to those that are really struggling the most to access opportunities.
Thanks, Laura. And then Craig is asking, are there early childhood champions in state and local government that you can work with to advance the mission?
So I can talk from the local perspective, and maybe Laura, I'll let you take the state perspective. But I mean, locally, I would say our entire county council is interested in this and very much wants to see the work move forward. I would also say the county executive is a big champion of this. He's a former school teacher, and he partnered with council many years ago to start the Early Care and Education Initiative. So there are advocates and champions in those local seats. And we are trying to work with them to find a path forward. Laura, do you want to comment at the state level?
There's certainly champions everywhere. Our governor is a huge champion of this and is really interested in addressing child poverty in holistic ways. The comptroller, as Britt mentioned, is taking on this issue, and it should be releasing another State of the Economy report focused on childcare in the next couple of months. And there's certainly advocates across the state who we're partnering with. But I will say, specifically when it comes to childcare, so not all of the holistic funds that are in this fiscal map, but childcare specifically is a broken business model across the country. So you'll often see that local leaders say, this is so expensive, we need the state to jump in. And then the state will say, this is so expensive, this won't be fixed unless the federal government jumps in, right? So it's a common issue in our country. There are champions everywhere, but it's still just a big, complex, and expensive issue to address.
Thanks, Laura. So let's see, we have a statement by Deborah. We've been directly affected by DC Pay Equity Fund. We cannot hire qualified childcare workers. The fiscal map gets to the heart of the issue, and which is that childcare is a market failure, and more public funding is needed to be invested for the youngest children to pay childcare workers more and take the burden off of families. The childcare workforce is shrinking at an alarming rate, and if we don't have childcare workers, we can't keep the economy going. Yeah, thank you so much, Deborah. And then I know Susan messaged me directly about this, but was asking about the libraries. And so I wonder if we could go back to that county slide really quickly and just show the libraries are in there. Here we go on the left-hand side, public libraries. It's early literacy is 17% of their overall budget, or 7 million in each fiscal year. And then Pilar is asking, where have you found the biggest pushback at local and state level? It's a great question, Pilar.
I think the biggest pushback is just the price tag, right? So these services really require a lot more money, and there are advocates for every cause, right? So right now, unless you raise new revenue, you're taking money away from somebody else. So it's a big complicated factor to try and figure out how to get more money into these services, because it would be, it would need new money.
So the business community has really been interested and has started to become our biggest allies in this. We've had 2 business breakfasts, one in April and one recently. We were starting to form smaller advisory groups with the banking community, contractors, folks who own small businesses. People are asking the question, how can we get involved? And that's what we want to see more of. We want to see more partnership among the business community, among the philanthropic community, which has already stepped in, like we showed. We really just want to continue building our partners. So Yesenia, thank you so much. And Jim, further on libraries, the Friends of the Library also gives MCPL money for early literacy programs and should be on our chart. Thank you so much for pointing that out. We were happy to include that. So we'll connect with you on that. So it looks like we're rounding the end of our presentation. I want to thank the team again. You guys are just what a great and valuable team I have here. We're really happy to see all of you participating, really leaning into the data and taking this on, and your questions were really thought-provoking. So look for more to come, and please access the report and download it and let us know if you have any feedback on that, as well as this presentation. Thank you so much for being here.
Thanks, everyone. Have a good afternoon.
Thank you.